Hello guys and welcome back again. Today I'm going to be talking to you about ovarian cancer. Do you know that worldwide there is an approximately 239,000 new cases of ovarian cancer each year, with an average of 152,000 deaths occurring in women with ovarian cancer worldwide? This is shocking. In fact, this is huge. Based on these statistics, ovarian cancer has been seen as the seventh most common type of cancer in women and the eighth cause of death in women. So this is really shocking and it's something that should be taken seriously. There should be a lot of knowledge about ovarian cancer and sensitization about it out there. But unfortunately, a lot of women do not know about this, and a lot of people also take the signs and symptoms for granted. And early detection can really lead to treatment of these forms of cancer. So in this video, I will be telling you all about ovarian cancer, what causes it, the signs and symptoms, the predisposing factors, that's things that can make you, at more risk of having this cancer, the ways it can be diagnosed, and also the treatment. And most importantly, how you can prevent it as much as possible. There is definitely no possible way that you can completely prevent it, but there are certain things you can do to reduce your chances of having this cancer. So if you would like to know all of this, please stay tuned. Do not forget to like, subscribe to my channel, and also leave your comments in the comment section. Now, let's get started. So what is ovarian cancer? Ovarian cancer is simply something that occurs when the abnormal cells in the ovaries and fallopian tube multiply and grow out of proportion. So this is simply those abnormal cells in your ovaries and fallopian tube multiplying out of control. This is simply the best way to explain what ovarian cancer is. Now, it's also important to know that this form of cancer is more common in the Native American and white population than it occurs in the African or the Black and the Asian and Hispanic population. Now, let's talk about the signs and symptoms of this ovarian cancer. So knowing these signs will help you to know if maybe probably you're having these signs. It's just important that you go visit your healthcare provider to get yourself checked out. So let's talk about them. Before I talk about these signs and symptoms, it is very important that you know that sometimes this ovarian cancer can spread throughout the abdomen even before these signs and symptoms can begin to show. So this really makes it difficult for early detection in some cases. However, I'm going to be telling you the common signs and symptoms. So one of the first signs is abdominal swelling. So when you notice that you always have this abdominal swelling that is not caused by anything you know of, and also when you eat, you notice that you just eat a little bit and you feel full, and you also lose your appetite very, very quickly, this could be a sign of ovarian cancer. Another one is vaginal bleeding, especially in post-menopausal women. So if you are in your menopausal period, you've experienced menopause, you're not supposed to be seeing your period anymore, and at some point in time you begin to see blood coming out of your vagina, please never ignore this. This could be a sign of ovarian cancer. Make sure you get to your doctor and get yourself tested for it. And the third one is bowel changes. So when we talk about bowel changes, it could be either constipation or diarrhea. So when you always have this constant constipation or diarrhea, it could be a sign of ovarian cancer. And then pelvic pain or lower abdominal pain. So when you always have this lower abdominal pain that you cannot really attribute to something, then it's something to look out for. Despite taking maybe some painkillers, strong painkillers, you still notice that this abdominal pain keeps coming back and back. Please make sure you get to your doctor and ensure that the proper examination is done to rule out ovarian cancer. The fourth one is frequent urination. Now, you're not pregnant and you're not diabetic, but you see yourself having this frequency in urination. It could also be a sign in people with ovarian cancer. And the final one I'll be talking about is unexplained weight loss. So if you're not on any form of, serious exercise to help you lose weight, you're not in any form of, diet to help you lose your weight, and you see that you're eating as much as you can, maintain a healthy form of, eating, and yet you see yourself losing weight, please ensure you get to your doctor to have yourself properly checked, as it could be a sign of ovarian cancer. So, having talked about these signs and symptoms, I'm going to be talking about what we call the the predisposing factors. So what are predisposing factors? They are the factors that puts you at more risk or that increases your chances of having ovarian cancer. And so what are these predisposing factors? The very first one is having an ovary. So being a woman, a female, puts you at risk of having ovarian cancer. In as much as this is very more common in older women, postmenopausal women, but it can happen to any female. So having an ovary puts you at risk of having ovarian cancer. Another one is being overweight. When you are overweight, it increases your chances of having ovarian cancer. Other disease conditions like having endometriosis or being diabetic also increases your risk. Note, these are called predisposing factors. It doesn't necessarily mean that when you're diabetic or you've got endometriosis that you're going to have ovarian cancer. Next is having a family history of ovarian cancer or inherited gene mutations such as BRCA1 or BRCA2. So these are the two gene mutations that when you have it, it puts you at risk of ovarian cancer. So for this, some people go for genetic testing just to find out if they have this kind of gene mutation in their family, because having it also increases your chances of having ovarian cancer. Just as I mentioned, family history. If someone in your family, especially if your mom or your sister have had ovarian cancer, it also increases your chance or likelihood of having ovarian cancer. Another common predisposing factor is having a previous history of breast cancer. So if you're someone who have had breast cancer in the past, there is also a likelihood that you could have ovarian cancer. And also, if you've had radiotherapy, is a kind of treatment, a form of treatment for some forms of cancer. So having radiotherapy in the past can also increase your chances of having ovarian cancer. Remember, as I mentioned earlier, having all of these or having some of these does not necessarily mean you have ovarian cancer, but rather they increase your chance of having ovarian cancer. Another common predisposing factor is when you have what we call early menarche or late menopause. So by early menarche, I mean when you see your period very early. So some people see their period quite early. Some people see their period between the age of 8 to 9. They are already seeing their period. So in this situation, it's considered early menarche. So this kind of situation can predispose a person to having ovarian cancer, because it puts the body, makes the body to be exposed to those hormones like estrogen for a very long period of time. And also, late menopause means you see your, menopause, your period stops quite later in life when it should have stopped earlier. So it means that the body is exposed to hormones like estrogen for a very long period of time. So all of these can increase one's chance of having ovarian cancer. And another important predisposing factor, which I've not even talked about, is being above the age of 60. That's just like what I mentioned, when you have, reached menopause. So this is very common in postmenopausal women. So being above the age of 60 also puts you at risk. Then the last two is not giving birth at all and smoking. So for instance, when I say not giving birth at all, not giving birth at all can somehow increase your chance of ovarian cancer, because it puts the ovary at work all the time. So you know that for a woman, especially women in their childbearing age, every month your ovaries get to work, produce the ovarian follicles, make sure they get to maturation, and then you see your period, and the cycle continues every single month. So not giving birth at all means that all through the period, maybe you're supposed to be pregnant, breastfeeding, and your ovaries are supposed to be resting, not overworking itself to produce eggs. In these situations, your ovaries has been working non-stop. So all of this can put stress on the ovary and lead to ovarian cancer. So that is it. And then finally, as I mentioned, is smoking. Smoking quite a lot of time increases your risk of having ovarian cancer. So these are the common predisposing factors that can, make a person be at a higher risk of having ovarian cancer. So having come to know all of these signs and symptoms, having come to know the things that can put you at risk, how then do doctors diagnose ovarian cancer? So I'm going to be telling you the various things that your healthcare provider may be doing in order to diagnose ovarian cancer. So let's go. So how do the healthcare providers, diagnose ovarian cancer? So one major way that ovarian cancer is diagnosed is through their assessment. So usually they perform a pelvic assessment on you. So in this pelvic assessment, they just check for any abnormal growth or enlarged organs. So they know exactly how to perform this assessment. But before then, usually they do some kind of questioning. They ask you various questions, regarding the signs and symptoms I mentioned earlier. Usually that is the first step before any form of, assessment or investigation is done. Then the next thing that is being done is blood tests. So blood test is a kind of blood test where they check for the CA level. CA 125 is what is called. So this is what is checked in the blood to find out if the levels are high. Usually when there is ovarian cancer, the levels of this CA 125 is high. So, but it is very important to note that even when there is no cancer, this CA 125 can be high. And even when there is cancer, there are situations when there is cancer and this CA 125 will be low. So usually doctors don't just base their diagnosis on the results of this blood test. So they base their diagnosis both on the results of this blood test and other investigations they deem fit to do for you based on your signs and symptoms and your specific situation. So the next thing your doctor can do to diagnose this ovarian cancer is the use of imaging tests. By imaging tests, we mean things like pelvic ultrasound scan, where they have a look around your ovaries to check for any form of abnormal growth. They can also do things like the MRI, the CT scan, and the PET scan. So these are the various kind of imaging tests which your doctors can use to diagnose ovarian cancer. The next way that your doctor can find out if you've got ovarian cancer is through a minor surgery known as laparoscopy. So here, a surgeon simply gets a little or a small cut around your abdomen, and then a laparoscope, which is like a thin camera, is passed down as a guide through that opening. Now, they use it to find out where that growing cells or those cancer cells are, and with that, they could either decide to remove those cancer cells or they might decide to take some biopsy if they suspect maybe it could be cancerous. They can take some biopsy, that is taking some samples from there and then take it for testing. So these are the various ways that your doctor can use to, find out if you've got ovarian cancer. So based on the results of all of their assessments, then a proper diagnosis can be made. So it's not just from a single sign you present or maybe a single investigation that can convince a healthcare provider to say, oh, you've got ovarian cancer. There are various things that can be done to help, make a definitive diagnosis that, oh yes, this is ovarian cancer. So having come to know that a definitive diagnosis can be made, what is the treatment? What are the options of treatment available for ovarian cancer? So it's important to know that when there is early detection, treatment can be offered. So let's talk about the various treatment options that are available for the treatment of ovarian cancer. So the first one is chemotherapy. Chemotherapy simply means the use of medications to treat ovarian cancer. So these are the use of medications that actually target these cancer cells and destroy them. You can take these medications orally or it can be given intravenously. So it depends on your specific situation. Then the next is the use of surgery. So when it is observed that this cancer cell is in a specific region and it has not spread, your healthcare provider might decide that a surgery is best. So those, or that particular area, let's say, for instance, the ovary, since we are talking about ovarian cancer, if it hasn't spread, your doctor or your surgeon can recommend a surgery to be done so that the ovary can be removed. So that is the surgical treatment of ovarian cancer. So the third point is the use of radiation therapy. So in this case, the use of radiation is used to destroy these cancer cells. So ionizing radiation is used to destroy the DNA of these cancer cells such that, you destroy them and they are not able to multiply anymore. And finally is the use of hormone therapy. Some of these cancers use hormones to grow. So what happens here is that with the use of medication, these particular hormones are blocked. So these hormones are blocked and then these cancers are starved to death. So these are the various treatment options that are available for patients with ovarian cancer. So let's talk about the final one, which is the preventive measures. So having come to know all of this about ovarian cancer, it's very important that we think about preventive measures, what we can do to help ourselves to as much as possible minimize the possibility of having ovarian cancer. So the very first thing you need to do to yourself is to listen to your body. Listen and look out for all of these signs and symptoms. And if you are worried about any of them, please do not hesitate to reach out to your healthcare provider for proper diagnosis and, if it is found, for early treatment. Next thing is to go for regular medical checkup. If there are situations where you are required to come for any kind of checks, possibly because they are suspecting something wrong, probably a cancer, please do not hesitate to go for this kind of testing because they can help in early detection of these cancers even before you begin to notice the signs and symptoms. And the two final things you can do is quit smoking. If you smoke, as we mentioned earlier, is one of the predisposing factors of ovarian cancer. And finally, try as much as possible to maintain a healthy weight. So by doing all of these, you will be trying your best to minimize your risk of having ovarian cancer. If you enjoyed this video or got value for it, please do not forget to give me a like and subscribe to my channel. Also, do not forget to leave your comment in the comment section. Ask about other topics you would like me to discuss about, and I'll be sure to do them. Thank you for watching, and I'll see you in my next video. Bye for now.